Hello, my name is Elizabeth Stoeckl. I'm a medical student here at UW, and my project is preoperative surgeon-performed ultrasound of massive thyroid goiter in rural Kenya. Thyroid disorders, including endemic goiter, are some of the most common endocrine disorders worldwide. Endemic goiter is estimated to affect 28.3% of the African population, despite introduction of self-iodization programs. Given a lack of available medical and surgical health care, many patients in low-resource areas cannot seek treatment of thyroid enlargement until the gland has reached a massive state. Massive goiter can cause compressive symptoms and social stigma in some contexts. The treatment is surgical, but local context has to be considered. How will postoperative complications be managed? If the entire gland is removed, that patient will need lifelong thyroid hormone supplementation, which may not always be available in low-resource settings. For high-volume surgeons, such as here at UW, ultrasound is a routine part of preoperative thyroid surgery planning to help assess the structure of the gland. Handheld ultrasound is increasingly affordable and utilized in low-resource areas and can assist in safe surgical planning. The Braze Clinic is an ambulatory surgery center in Migori, Kenya, affiliated with the organization KenyaRelief.org, and is the site of year-round medical and surgical relief teams who work alongside local surgeons from the tertiary care and referral hospitals, such as Moi Teaching and Referral Hospital. Our study was approved by the UW IRB. All patients presenting with goiter received thyroid-stimulating hormone testing, a free T4, and a neck ultrasound performed by a single surgeon, UW faculty Kristen Long, using a portable ultrasound permanently housed in the Braze Clinic. 57 total patients were evaluated, and we found that most patients in Migori presented with goiter that appeared clinically bilateral, but on ultrasound was actually unilateral. You can see this in the picture, in which the lobe on the left is significantly larger than the yellow line on the right, indicating the contralateral lobe. In fact, 80.8 or 42% of our patients had unilateral goiter, with one lobe over 5 times the volume of the other. So these patients could be safely treated with a unilateral thyroid lobectomy. Only one patient had a postoperative complication, a neck hematoma requiring operative evacuation. So in this way, preoperative ultrasound allowed this unique unilateral disease pattern to be identified, and patients were surgically managed with a more conservative unilateral lobectomy. Our project is relevant because access to surgery is a serious global health issue. 5 billion people do not have access to safe, affordable surgical care when they need it, especially in low and middle income countries. Diseases like massive thyroid goiter demonstrate the serious morbidity and quality of life issues associated with lack of surgical access. Even though the need for surgery is great, short-term relief efforts are inadequate because the consequences of a surgical complication have to be taken into consideration. In the case of thyroid surgery, recurrent laryngeal nerve injury or hypoparathyroidism can be lethal without appropriate access to diagnostic labs, advanced treatment, or consistent medications. And as discussed, performing a total thyroidectomy without considering a patient's ability to access lifelong hormone supplementation could have serious long-term health impacts. So in our case series, ultrasound allowed patients to be safely selected for a more conservative thyroid lobectomy rather than total thyroidectomy, which treated the goiter but left behind functional thyroid tissue. Violation of the contralateral central neck and thyroid bed were avoided, so there was less scar tissue. So if the patient needs future surgery, that will be easier, and there's also less possibility of bilateral recurrent laryngeal nerve injury and hypoparathyroidism. Thus, implementation of affordable advanced technologies such as high-resolution ultrasound can be performed even in extremely remote settings and used to facilitate safe, context-appropriate operative planning. Thank you for the opportunity to share our work today.